Unnecessary caesarean sections put both the mother and child in a high-risk category and could lead to complications. In the United States, C-section rates are more than double the World Health Organization's recommended average of 15%. Nurses and physicians are providing care that facilitates an optimal delivery method that best suits the patient's birthing plan. Lynette Americas has utilised feedback from physicians and nurses to create a revolutionary birthing bed that improves the safety of mother, baby and nurse.
With its dozens of different positions and features, the Ave2 by Lynette Americas gives patients the ability and ease to move during childbirth.
We encourage our patients to get up and move if they don't have epidurals.
What is the benefit of movement in childbirth?
The benefit of movement, it's the natural progression of labor. The baby needs movement during the laboring process to kind of reach the goals of turning and getting into the proper alignment for birth.
It's a benefit essential to ensuring a safe labor and delivery.
I mean, anytime we have a patient that is hopeful for a regular delivery, that's our goal. Our goal is always to have a healthy mom and a healthy baby. So we all know that, C-section is a major surgery.
A major surgery which puts both mother and baby in a higher risk category and can lead to potential complications.
When we, have to call a C-section on a patient that's not expected, we take it very seriously.
There's a pressing need to reduce the rate of cesarean sections in the U.S., where, according to the World Health Organization, the current average rate is double the advised rate of 15%. And movement provided through this innovation in design is helping to achieve a physiological birth when possible.
How does that happen? Because of all the different positions we can get the patient in. So maybe it is that the patient gets on all fours and some of the pressure is lifted and, instead of rushing to a C-section, we can help the baby get into a better position in the birth canal.
Nurses like Sheila Dempsey, who have been in hospitals for decades, have seen dramatic changes in the technology around them, but not in the beds. With very little innovation in birthing beds over the past 15 years, Lynette has set out to revolutionize the industry. And one of the ways they're doing it is with this, the Ave2, designed by nurses for nurses.
Hi, how are you? Hi, Jenny.
Hi.
Hi, Miss Jones, how are you? It's a very special time in the mom's life, but as well, it's I feel very honored to be a part of it.
So how does this bed help you care for your patients?
When a patient comes in and the doctor needs to do a vaginal exam, we can just lower the bed. And then when the doctors come, it's very easy to get the patient in multiple positions for pushing.
I think it offers a wider range of positions that you can move the patient in without them having to physically move. So you can drop the foot of the bed, you can put them in a sitting position, you can angle up their hips in a different position. Versus if the patient has an epidural and they're not as freely to move, they're not able to move their own position as easily. So these beds have made it that we have more ability to put the head up and the bottom of the bed up a little bit more for them, so that there's definitely different ways to make them more comfortable.
Not only does the innovative design of the Ave2 birthing bed help facilitate physiologic childbirth, but it also addresses the high exertion task put on nurses as they care for mothers in the labor and delivery process.
The best part of the bed, the biggest wow feature, is this drop footrest. You drop and you stow. Because the average age of the labor and delivery nurse is 48 years and plus, so those footrests are heavy to use. So we eliminated that one step.
So we're just going to get a blood pressure.
The work of the caregiver, it's very strenuous. In fact, caregivers today, nurses today, actually suffer more injuries than construction workers. It's really hard to believe, but it's a true fact. And we take that very seriously. We want to look at ways to improve how they care for patients, make it easier for them, make it much safer for them, and keep them at the bedside.
That commitment to designs which improve care earned the Ave2 the coveted Red Dot Award, which is an international award given for excellence in innovative design.
One of the reasons I feel Lynette is so strong, we design the bed, we just don't go with a bioengineer or biomedical. We really get the clinical input and the caregiver or the end user's input. To have the nurses believe in our products, as I do, and once you show them all that our innovative products can do, You see them, their eyes light up like, wow, this is great.
And after incorporating feedback from nurses on the front line, Lynette has created this innovative birthing bed, which leads to improved care and safety for both the patients as well as their nursing staff. In New Jersey, I'm Danielle Elias.